Hi, my name is Chris Ellis. I'm the CEO of the Institute of Holistic Leadership, and welcome to Holistic Living. Today we have Patti McCormick, who happens to be the founder and the president of the Institute of Holistic Leadership.
Hi.
Welcome, Patti.
Thank you for inviting me today.
And today we're going to talk about hypnotherapy.
Yes.
So Patti, how did you become involved with hypnotherapy?
Well, actually, it was the first holistic modality that I was interested in. I worked in we're in Dayton, Ohio, so I worked in a local hospital. Mm-hmm. One of the things that always intrigued me, and I worked in an ICU setting where we had, granted it was a long time ago, but we still had all the cardiac monitors and the labs were stat, and what I would notice is there would be, I'm going to say like two patients, and I would call them clinical twins. Blips on the cardiac monitor were the same, lab work was the same. Mm-hmm. But when I would go in and talk to the patient, there would be a difference in their attitude, or as I call it, the relationship with their disease process. Mm-hmm. So I remember there were two men in there, and both of them had myocardial infarctions, heart attacks. They basically were clinically very similar. But when you would go in and talk to one guy, he was an avid bicyclist. And, like day one, he's like, when can I get on my bicycle? How long is it? And he just couldn't wait to get out and start doing things. The other gentleman was very fearful, and rightly so. I mean, I understand they can be fearful, but we couldn't even get him to hardly get out of bed, rehab. And it was amazing to watch the gentleman who had a goal, who wanted to get out, who believed he could do it, how much more quickly he responded to healthcare, and how much he got out of the hospital so much faster. Mm-hmm. His outcome was much better. And the other gentleman, it took him a longer time, and I don't think he ever really got back to. And I would see that over and over. And so what I would say to myself is, what can we do to help improve for the gentleman that was so fearful, mm-hmm. Believed some of the things that he read? This other guy was like, I'm going to work with my doctor. My question was, how can we help individuals change their relationship with their disease process? How can we help their attitude? What can we do about this?
Right.
And so in doing that, I began to explore what modalities would help. And I'd always been interested. I did a double major in nursing and psychology. I've always been interested and amazed at the power of our mind. Mm-hmm. We haven't even tapped into that yet. Mm-hmm. And that kind of led me in my research to hypnotherapy. And so I took training. Back then there was nothing in the Midwest. Mm-hmm. I had to go on the East and West Coast for most of my training in clinical hypnotherapy. And the interesting part, the amazing part of it is I was able to come back, start a practice, and maintained a practice. Just recently, because the school is so busy, I no longer see clients. But I've had an on and off practice, full-time practice for a long time, utilizing clinical hypnotherapy to help patients in a variety of areas.
Huh. So what is clinical hypnotherapy then?
Clinical hypnotherapy is basically helping the client achieve a relaxed state. And when you're in that relaxed state, many times there's a conscious and an unconscious mind. And the conscious mind is the part of your mind that says, I've got to balance my checkbook and I have to do this. And the unconscious part of your mind is the part of the mind that basically runs us. I always joke about like a chocolate chip cookie's laying there, and your conscious mind says, I've had too much sugar, I don't want to eat any sugar today, and I'm not going to eat that cookie today. And then an hour, 2 hours later, the cookie mysteriously appears in your mouth. That's right. The unconscious mind. Right. There's some need that it wants to get met. Mm-hmm. And so when you are utilizing clinical hypnotherapy, then what you do is you help that person get in contact and communicate and kind of reprogram their unconscious mind, so they can begin to do the things they want to do, meet the goals they want to meet, mm-hmm. and have the life that they want to have. So
then how is hypnotherapy different than mindfulness?
Well, it's very similar. Let me say a couple things about hypnotherapy. That will kind of equate. When I am doing hypnotherapy, clinical hypnotherapy on someone, I'm guiding them into a relaxed state. I do want to clear up the misconception that you can control people in hypnotherapy or with hypnosis. There's a couple, what I do many times when I'm teaching a class, I always say if I could control people, I wouldn't misuse it a lot, but I can tell you my car would be washed once a week and my house would be clean, okay? I would have someone doing that. I cannot control people. One of the things I do when I'm doing a demonstration, I ask everyone to put their feet on the floor, and they do. And then I say, take a nice deep breath and exhale, and they do. And then I say something about maybe lean back in the chair and feel where it supports you, and they do. And then I say, I'd like you to take your checkbook out and write me a check for $1 million. And they immediately open their eyes and look at me, and I'm like, that's right.
Right.
You have, no one is, over 40 years, no one has ever written me a check for $1 million.
Right.
You always have control.
Right.
No one can make you do something that you don't want to do. So we have this part of our mind that really wants to achieve change that's good for us, or change that's not threatening, but that is right for us. You know, another example, I keep talking about this brain. This brain we have is the most phenomenal computer, and we still haven't tapped into it. But it's interesting, I always use an example of a lemon. And I'm going to ask the viewers to kind of go along with this. I'm going to ask you to go along with it, but to imagine that I have this beautiful, big, juicy lemon right here, and I've just sliced it, and I've given you a slice, and everyone out there watching a slice, and you're sucking on this sour, juicy, tart lemon. You know, I can see right now, checking your physiology, and it's probably happening to you that are watching the show. The jaw starts to tighten. You know, more saliva came into your mouth. You know, those, in less than 30 seconds of you thinking about a lemon slice being in your mouth, you changed on a physiological level. Your brain, without thinking, that unconscious mind said, oh, there's a tart lemon in my mouth. I need to dilute that juice. So what I need to do is produce more saliva. I need to kick in the salivary glands. I need to dilute the lemon juice. I need to tighten my jaw. I need to have this person swallow. And all of that happened in seconds. There was no lemon in your mouth. You know, that's the power of the mind. What we think can affect our physiology. I use the example of a dream. Your dream is your unconscious mind. You dream there's a giant spider coming at you. You wake up, your heart's pounding, and for a few seconds there, even though you know there's not a giant spider by your bed, you can feel the stress. You can feel the fear. You can feel the physiological response to the fear. Your heart beating fast, breathing fast, your muscles tightened. So you always have control of yourself. So I want to clarify that. I kind of look at mindfulness, visualization, hypnotherapy. Well, hypnosis is the skills that take the person into that relaxed state. That's what mindfulness is. Then what happens with hypnotherapy, either with self-hypnosis or utilizing a hypnotherapist, we then, because we've done an intake and we know what your goals are and we've come to agreement, we then provide suggestions that help you create what you want for yourself. So if you wanted to excel in sprinting, we could have you do an image of yourself, you know, sprinting and getting better scores and run times, and we could do that. Again, because that's what you want to do. It's your goal. You know, and at the end of your sprint, again, if I said, write me a check for $1 million, you would say, no, you're nice, but I'm not going to do that. So we work with your goals and allow you to use your mind, just like you experienced that lemon, to achieve your goals. You thought of the lemon, your body followed. You think of a perfect sprint. Hypnotherapy is used a lot in sports. You know, they call it imagery. There's a lot of names for hypnotherapy. It could be called imagery. It could be called visualization. I know one time people were a little concerned and afraid of hypnotherapy, a group, and so they asked me not to do hypnotherapy. They said, but could you do visualization? And I had my lecture prepared the day before. I said, I'd be happy to. So I just went in, took the word hypnotherapy out, put the word visualization in. I mean, I'm sorry, the opposite. I took visualization out. No, I took hypnotherapy out, put visualization in, and did the exact same lecture. Because it is the exact same process. There's different techniques to help people become hypnotized, but it's a normal state. Have you ever driven down the road and you get to a point and you go, oh, how did I get here? You know, I don't even remember. You were in a state of hypnosis. Your conscious mind kind of went away and your unconscious mind kicked in. You never do that in a new city on a new route. You do it on something that you've done over and over and over.
Right.
And so because your unconscious mind knows how to do that, you just kick in. If you ever watch a movie and it's almost like the house could fall down around you, but you're so into the movie, that's a state of hypnosis.
Right.
So we experience hypnosis all the time. It's just a normal, natural state.
Right.
When you go to a clinical hypnotherapist, they can help you get there to that state, and then they can help you with giving you goals and giving you suggestions that can help you achieve what you want to achieve.
That's very interesting. So how do you go about hypnotizing somebody?
So what happens when someone comes in
Right.
to my office? We do an intake. We sit down and just talk about their past and then get very clear on what their goals are. That's, again, I think one of the most important pieces, that we help them clarify what they do want. Then I invite them I have a recliner, and I invite them to sit back in the recliner. I do have a nice lamp, but I turn off the fluorescents, because the fluorescents are light. But the room is lit. I put on some soft music just because I am in a setting, a business setting. And then I put on some soft music, relaxing music, and then I just begin giving them suggestions. I begin talking to them again. Because, I hate to admit this, you're doing it, I'm doing it, people who are watching this show are doing it. We're thinking about, I got to go get groceries, and I've got to do this, and then I pay those bills, and I got to get my car washed. But when you're in the state of hypnosis, all that stuff moves out of the way. So you can truly listen to the words that you helped create with the hypnotherapist. I always tell my clients, if someone came in my office and said there's a fire, the person in hypnosis would respond faster. Because for me, it has to go through the clutter of the laundry and the grocery and the dirty car. It has to go through that clutter. The person that's in the state of hypnosis, that clutter's kind of moved out of the way.
Oh,
so they would actually respond faster than I do. You can move when you're in a state of hypnosis. You don't have to lay there like rigor mortis is set in. You can move, you can scratch your arm. Your goal is to just be as comfortable as you possibly can.
Right. So you mentioned before, you can't make a person do something they don't want to do.
No.
So are there other common misconceptions when it comes to hypnosis?
Well, I think we've covered most of them. Again, I think the big one that comes in, and a lot of people, when they come into my office, the one thing is, can I control them? Can I make them do what they don't want to do? I've actually had people call and say, can you make my husband clean the house? Can you make my wife? And it's like, no, that doesn't work.
Right.
There has to be some goal. The person has to have some desire to make some of these changes. So that's a big misconception. The other one is that they will be totally out and not hear anything that's going on, and that's not true. As I mentioned before, they will hear what's going on. And I always have to reassure the client, when you're in hypnosis, we don't have words in our vocabulary to explain what I call states of consciousness or awareness. So for example, when you go to bed at night and you fall asleep, and then you wake up, if I said, when you're asleep and when you're awake, but if I said, tell me what that feels like, and you might describe it, well, it feels like I'm relaxed. I'm like, no, tell me what it feels like to be asleep. We don't have words for that. You just know you're there. Same thing with hypnotherapy in the state of hypnosis, that trance state. You just know you're there, but you really can't describe it. But when you come out of hypnosis, and we bring you out of hypnosis with a very pleasant, there's a variety of different ways. I just use a very simple count from 5 up to 1, have them open their eyes on the count of 1, and they feel great. They notice a difference. But at the same time, they really don't have words to describe it. They may feel a little, I'm going to say, disoriented for a few minutes, just like when you sit up on the edge of the bed. And they just kind of sit there and relax in it. So
what can hypnosis be used for?
Oh, so many different things. I mentioned sports. As a clinical hypnotherapist, my practice was primarily focused in the healthcare industry. I had a lot of physician referral. Probably 75% of my practice was physician referral. Not because, people say, well, that's just because you're a nurse. Not because I'm a nurse. It's because I took the time to go speak to those physicians and speak to the office staff and say, here's what I can do for your patients. My goal, and the goal of all of our graduates, is not to take people away from the medical community, but to actually let it be a part of the medical community, to help those healthcare providers take better care of their patients with what we can do.
Right.
So I did a lot in the area of pain control. It's interesting, in nursing, my least favorite area of expertise was labor and delivery, and yet in hypnotherapy, I had a very large hypnotherapy practice for women going into labor and having children, the childbirth portion. And then I would even have them come back after they had the child, and we would do some hypnotherapy to just help them with that, especially if it was a new mom, the concerns about being a new mom and that type of thing. So I did a lot in childbirth, hypnosis, pain. I did a lot for individuals who were frightened of procedures. I know there was a patient who was very afraid of a glaucoma test, and the physician referred them to me and said, can you help this patient, because we can't do it. We have to. It takes 4 of us to hold her down, and she still jumps when we do the little, the test. 2 sessions of hypnotherapy. I got a letter from the physician, and he said, "Thank you very much. We were able to go through. It was a success. We were able to go through the procedure with no issues whatsoever." So a lot of times, and I even did some minor, and I want to be very clear with this. I even did some minor hypnoanesthesia, where the patient couldn't take a lot of anesthesia for medical reasons, and so we were able to utilize hypnosis so they could take a much lower dose of the anesthesia during the minor surgical procedure. Right. So
well, that's very interesting. So, what about like smoking and stuff like that? I mean,
you can behavior change. Yeah, people want to do it for behavior change also. And yes, you can do hypnotherapy for any kind of behavior change, anything that you would like to be better in. We have people come in for sugar addiction. They just can't give up that sugar for some reason, and so we do hypnotherapy for that. Smoking has been a big one.
Right. It's kind of the.
It's kind of the thing that people come for, and it works amazing. I run like a 98% success rate for smoking with 2 to 3 sessions. Because it is, one of the things we always talk about, smoking versus food. Hopefully, you did not smoke the day you were born. People started eating the day they were born.
Yes.
The other component with that is that you can live and never smoke a cigarette again. You can't live and never eat again. So every day there's that decision-making factor that comes in. So you have a lot, and again, in our society, we celebrate with food. Nationally we do. We have parties, we have weddings, and there's always food. There's not, we don't walk around and pass out packs of Camel cigarette at a birthday party, at our daughter's birthday party. So
if a client were to come to you for some behavioral change, and they were to become hypnotized, so how would they feel? What would that be? What would that be like?
They would, and this I've said this over and over, but I want to emphasize, they would just feel relaxed. And while they were relaxed in that chair, and I even experienced this the very first time I was hypnotized. While they're relaxed in that chair, they're not laying there going, I'm hypnotized, I'm hypnotized, I'm hypnotized. Just like when you're asleep, you don't lay there and say, I'm asleep, I'm asleep, I'm asleep. It's not until you wake up that you notice the difference. With hypnosis, it's not until you come out of hypnosis that you notice the difference of what you felt like when you were in hypnosis. So you are just going to be relaxed. You're not going to be as aware of noises around you. Again, if there was an emergency and someone hollered fire, you would respond quickly. But if people knock on the door, I have a door that goes to the parking lot, and every once in a while someone will walk through. I will notice it, and the client never notices it. They just, because they know it's not a threatening situation. So they just feel relaxed and comfortable back in the recliner. People will say, what if I fall asleep? If you fall asleep, your unconscious mind is still on. Because when you're sleeping at night, if there's a strange noise, if your dog knocks over something, or if an alarm goes off, because you will immediately wake up and respond. Now, if you have a grandfather clock that you've been listening to for months, years, every time it goes off, you don't respond to it. So your unconscious mind is always listening. That's on 24/7. And it learns through conditioning what to respond to and what not to respond to.
So speaking of your unconscious mind, so what is the science behind hypnosis?
There's so much research, and people do not realize this. As a matter of fact, I want to make sure I have the title straight. And I was able to take some classes through him, underneath him, and he's been part of conferences that I'm in. And I recommend people look this up. There's a Dr. David Spiegel. He's an MD. Mm-hmm. He is the Associate Chair of Psychiatry and Behavioral Science at Stanford Medical School. They have so much research out there on hypnotherapy, the state. They've actually measured what goes on in the brain when you're in the state of hypnosis, and indicated and documented the differences. They've also, as I mentioned, hypnosis and pain is unbelievable what it can do for pain, because just the component of stress, I call it the pain stress cycle. When you have pain, what's the first thing we do? We tighten up. And when we tighten up, what's that do for our stress? I mean, our pain. It makes the pain worse. And then we get more stressed. And then so it becomes this vicious cycle. So the first piece is the minute you relax the person, decrease that stress, then they have a lessened sensation of pain. And then that cycle continues. And then a lot of people, a lot of times I've taught people where they can do self-hypnosis. And they go home and they imagine a knob, like an old-fashioned radio. And they look at where it's at that indicates their pain. And if it's an 8, then they take a few deep breaths and just imagine that they're turning that down to 7 or 6. And when they do that, the pain diminishes. Now, this is programmed. They come in the office. We do sessions. We teach them how to do it. They go home and practice. They practice in the office. But now they go home with the tool that they can use to decrease their pain. So
that is a form. Is that a form of self-hypnosis then?
It actually is. It actually is. It is, and that's one of the things I really like to do is empower my clients. It is, for them, they are taught a tool of self-hypnosis that they can use at home. A lot of athletes use this. And, if you see, because of grandkids and family members, we're seeing a lot of basketball now. And I've been watching a lot of these guys, and I've been, researching. I find sports boring, and so I have to research what's going on in their head and what are they eating and what's their nutrition, and a lot of times when you see them with their towels hanging over their head, they're doing their hypnotherapy, their self-hypnosis, or they're doing some of them call it visualization, some of them call it imagery. That's what they're doing during that time. Someone has coached them, and if you read a lot about sports teams and things like that, you will find, in addition to all the athletic trainers and the defensive coaches and all those other people, what you will find though is they usually have a coach that comes in that deals with their mental attitude and helps them with visualization and gives them little brief self-hypnosis tidbits that they can do while they're on the field, on the floor, whatever it happens to be. So it's very common in sports, and it can make a significant difference.
So just briefly, how can hypnosis be used in the medical field? So we talked a little bit about sports, we talked a little bit about self-hypnosis. So what about in the medical field? You did touch on pain.
Yeah, and I think, it primarily pain, procedures, preparation for procedures.
Like anxiety before.
I've done a lot with pre and post surgery. It's people were afraid to have the surgery, right? Sometimes rightly so, and they may have had a bad experience. So to help prep them so that they're calmer for surgery, things like that.
I gotcha. So thinking about it, so how would someone go about to have a practice in hypnotherapy?
And I'm going to kind of combine these together because I think it's important. You can't just pick up your phone book and look for your local closest hypnotherapist, because training is extremely varied for clinical hypnotherapy. And so you want to make sure when you have a practice, you're seeing a client every hour to hour and a half. You want to make sure when you're the client that you are going to someone that has gone, like for example, we're a state-approved school. There's others that has gone to a state-approved school, that they've had interaction, that they've had what I call clinical practicums. by the time our students get out of class, they've been hypnotizing each other. Sometimes we bring in other people. They have case studies. They have peer reviews. They have been working with other people. You want to make sure that, I always say, they've done the practice in the classroom. You don't want to be the first person they've done the practice on. So you have to be very careful with that. With that also, it is, it is not as regulated as, for example, nursing is in most states. So you have to do your due diligence. Don't hesitate to ask them where they took their training, how long was the training, like did they take psychology, did they take anatomy and physiology? I think those are critical in a setting. I also look at, if someone comes to me and said, I'm having this pain, I would not treat them until they saw their physician.
That's a good point.
Because the pain could be from stress. The pain could be something minor, but could also be something more serious. And we are not, as clinical hypnotherapists, diagnosticians, unless we're a physician. And so a specific kind of physician. So we're not diagnosticians. So I think it's very important that you go to someone adequately trained. Don't hesitate to ask. And then hang up the phone, don't book the appointment, and look up the school. Look up where they went, look up previous practice, look up reviews, see what you can find about them before you book that appointment, and talk to several. So
in the last few minutes we have, what has been your experience? We talked a little bit about your successes with hypnosis. So what would you think, like maybe your top 3 most successful type situations for hypnosis?
I would say the area of pain.
Okay.
Pain, smoking, and just very quickly, I need to talk to you about this, if you don't mind, this one client.
Yeah.
I loved it. He, when I first started my practice, I shared an office with a physician. And so we shared the waiting room, and then I had my office and the physician had their office. And so there was a gentleman that I knew from coming into the office for so many years, because for previously I had worked for that physician. And it was kind of funny because he came in, his whole family came, his adult daughters came in. He came in, he made an appointment for hypnotherapy. He had been a Camel 3-pack a day, non-filter smoker. This gentleman was probably in his 60s. He had been that since he was in the military as a young man. He came in, he sat down. He said, I closed the door, started to do the intake. He said, I just want to get something straight right now. I do not plan to stop smoking. I do not want to stop smoking. And I said, why are you even here? He said, here's the deal. And we always talk about there has to be some motivation behind it. Well, what was interesting is sometimes paying the money is motivation. If I've put a little, as you say, skin in the game, it means more to me. Well, he said, here's the deal. My daughter said she was going to pay for this session. She's going to pay for 2. Because I always did 2 sessions. If I came in, did the 2 sessions, and continued to smoke, she's not going to complain to me again. She's not going to nag me anymore. And I said, this isn't going to work. And he said, I know, I don't care. I don't want to stop smoking, but I want to get her off my back. I said, let's do it. So we went through the process. I gave it 110% like I would any client, but with a belief of this really isn't going to work. Interesting. We did the session. I always had them throw their cigarettes away right there. I don't believe in titration. If you smoke, like 10 today, 9 tomorrow, 8 the next day, you have a bad day, you're back up to 9, you're back, So you're done, because if you're a non-smoker, you don't need cigarettes. Well, it was interesting. He came back in a week later. I said, how are you doing? He said, you're not going to believe this, because I don't. I said, why? He said, I haven't had a cigarette since then.
My goodness.
I know. He said, I would have bet. I'm not a gambling man, but I would have bet that I wasn't going to stop. He said, I went out. I thought I was going to stop and get a pack. And he said, it just didn't happen. He said, I did not want them. And he said, after the first day, I thought, well, let's just stick with this and see what happens. And he ended up, for the rest of his life, being a non-smoker. And just from what I know in healthcare and nursing and what all of us know, probably had a higher quality life and lived a little longer. Because he had, even though he had smoked for all those years, was able to have a healthier life because of that.
That is fantastic. All right, so we're going to leave it there. Patti, thank you so much for coming.
You're welcome.
We look forward to seeing you on the next show.
Okay, thank you so much.
Bye-bye.
Bye-bye.